CBS News Chief Medical Correspondent Dr. John LaPook joins us now. Doctor, the World Health Organization back in 1988 warned that alcohol is linked to cancer. Why is the Surgeon General suggesting this now?
You know, Major, there's been a growing body of evidence over the past few decades that links alcohol to cancers, but only about 45% of Americans know that, compared to, say, 90% who know smoking causes cancer. So Dr. Murthy, who is our Surgeon General, is trying to get the word out, and he specifically cancer of the mouth, the back of the throat, the voice box, the esophagus, which is the swallowing tube, the colon, the liver, and the breast.
Doctor, the Surgeon General's report states that having even one drink a day increases someone's cancer risk. So, what's the definition of a drink?
Yeah, that changes from person to person. One drink is a can of beer, which is about 12 ounces, a small glass of wine, about 5 ounces, or a shot of hard liquor, that's about 1.5 ounces.
So, Doctor, this might be confusing for some people who may remember hearing something about wine, for example, might be good for their heart.
I know, and that makes people, angry at times. What do we do now? And there were those studies back in the 80s that suggest that red wine might be good for the heart, but that research has come under question because there are so many variables that are hard to control for, like diet and exercise, environmental exposure, family history. The bottom line here, Major, based on current research, is there's no safe amount of alcohol when it comes to cancer risk. It's really hard to say exactly what's the risk in one particular person. So if ever there was a time to talk to your healthcare provider about your individual risk, what you should do, it's now.
Just to put a button on this, Dr. LaPook, do people genuinely listen to these kinds of warnings?
They do. Look at smoking. It's down dramatically after the Surgeon General warning in the 60s.